What's up, guys? This is going to be a quick lesson regarding a topic within abnormal psychology. Look, full disclosure before I begin this lesson, this, to be super honest, is coming more of my idea, so it's more subjective. And even though it is validated by some research in the field, other research in the field, and other professionals in the field don't agree that much with it. So full disclosure, this is a little bit more subjective, it's a little bit more on my end. Based on my experience in the field of mental health. I had about 4 years of experience in the field of mental health, so it's not a lot, it's not too little, but I did so many things, I do want to disclose a little bit of this to you. So, watch out, this is coming out from my end. Alright, full that, let's move on. The thing here is, across the field of clinical psychology, there are categories for the disorders that we'll see in other lessons. So for example, you have anxiety disorders, and there's a category, anxiety disorders, and you have a bunch of disorders there that have to do with anxiety. Within anxiety disorder, you have panic disorder, you have obsessive compulsive disorder, you have social anxiety disorder, you have phobias. All of those have one factor in common, which is anxiety. So we'll learn about disorders from the perspective of different categories. This video, though, is borrowing one specific idea from one of the categories, and that's developmental disorders. Developmental disorders is a category that defines all the disorders that are more common in children and in adolescents. There are specific rules, there's a specific set of guidelines within those. One of them is a little abnormality is normal. And I do want to bring that up because when we read and we spend the whole semester reading about all these disorders, it becomes tempting and it's super easy to now believe that every member in your family has one of the disorders that you're seeing there. If not, maybe even you have all those disorders, which actually is a term called as medical student syndrome. Medical students read about all the different diseases that exist, and because of how common all the traits may be in some end, a medical student very often thinks that they have all of them, you know? It's kind of funny because I did date one time a girl that was a medical student, and it's funny because she did actually thought very often that she had a bunch of different diseases. We may be tempted to think about it that way in clinical disorders as well, but a little bit of abnormality is normal. And this is when it comes to the point of traits versus diagnosis. The thing is, everybody can have traits of a clinical disorder. Everybody can. On my end, for example, I like to be organized. I like to have my things in order. I feel kind of annoyed when I see dirty dishes. I feel kind of annoyed when I see that the trash can is too full and I haven't taken it out. I live on my own, so those are ideas that are coming through my mind. It's not like I have to blame someone else for doing it. Like, this is me. In the mornings, I wake up and I have to make my bed. I don't feel comfortable getting up even to have breakfast before I make my bed. That's just me. I like order. If I read about the symptoms of obsessive compulsive disorder, I might mistakenly assume that in a way I fit the criteria, so that must mean that I have that clinical disorder. This is where you make the distinction. You can have traits. Everybody can have traits. That doesn't mean that you meet the criteria to be given a diagnosis. What differentiates the traits from the diagnosis? The diagnosis then meets the criteria of the 3 Ds of clinical disorders, psychological disorders. When the traits are off the norm, deviant. When the traits are quite stressful to the person or to those around the person, distress, and more than anything, when the traits don't allow you to have a normal life, dysfunction. That's what differentiates a trait from the diagnosis. This applies to every clinical disorder that you'll see through this semester. If a family member passes away, you might feel sadness. That might not translate to depression if it doesn't have the 3Ds. A kid may have a lot of energy and a little bit of difficulty engaging in school. That may not translate directly into ADHD. A person drunk might hallucinate that other people are very likable and are seeing them very likely, very charismatic. That doesn't mean that it's schizophrenia. And so on and so on and so on. Watch out. For all the lessons and all the disorders that you learn about here, if you believe that family members or yourself have it, that's the point where you gotta ask traits versus diagnosis. And especially when you move to the field as a professional, to what point is this person that is in need of an assessment, or to what point is this person that is in need of therapy meets the criteria for this to be a diagnosis, or is showing off traits the same way that I would have. Sometimes, while we're immersed in the clinical area, and here's where I bring a little bit of my experience in the mental health field, when you are immersed in the area, and now you work, say for example, in a psychiatric hospital, you see a person coming in showing the slightest show of anxiety, the slightest sign of anxiety, and before you notice it, you're like, no, you know what? Generalized anxiety disorder, this person needs to stay here for observation purposes and better take care of this now before it gets worse. And sometimes treatment worsens the problem. So a skilled clinician must have a critical eye. It seems easy when you see it as a student, but it can become very hard when you're immersed as a professional. Watch out. Traits versus diagnosis, good lesson.